Well, good evening, everyone, and welcome to the Brian Crombie Radio Hour on Saga 960. A person that I've had on my show, I think twice now, and I'm really pleased to have back, is the leader of the New Democratic Party here in Ontario, Andrea Horvath. She is a member of provincial parliament from Hamilton. She's been a member. She was on city council before that, and she's leader of the official opposition here in Ontario. And I wanted to check in with her to see what she thinks about the plans for reopening schools. Ms. Horvath, thank you so much for joining us.
My pleasure, Brian. Thanks for the invitation.
It's our honor. So tell me, what's the NDP and your position on the reopening of schools? Are we doing the right job?
Well, I mean, we're about 3 weeks away at this point from schools opening, and I'm hearing a lot of concerns from pretty much everybody. Parents are really trying to make a decision that no parent should have to make. You know, do I stay home from work just to stay with my child because I don't want them to get sick at school, or do I go back to work and risk my child's health and risk COVID, creeping into our household? So parents are pretty worried, and as you know, the government's had so many mixed messages and so many redos, if you want to call it that, do-overs on the back to school piece. It's just created so much confusion and so much difficulty for parents, as well, of course, as educators and school boards. What the government has done, I think, is try to do the return to school on the cheap. I really believe they're trying to pinch pennies on the backs of our kids. And we know Doug Ford has a problem with public education in the first place. We saw he wanted to get rid of 10,000 teachers, and he was increasing class sizes before COVID even hit. And now he's got this bargain basement kind of attitude towards getting our kids back to school, and it shouldn't be that way. Our kids need to be back.
What do you think should happen? Should we have dramatically like half-size classes, or what?
Well, I mean, I think following the experts' advice, particularly kids and others who have said, regardless of the age of kids, there should be distancing. So they're saying 15 kids, maybe 20 at the max. But of course, it depends on the size of the classrooms. You want to have at least that 1 meter distancing for children, and you want to make sure that there's use of PPE. From what I can see, this is something the government has not provided enough resources to achieve. And, telling the school boards that they can dip into their reserve funds, it's still not good enough. I mean, initially with the government announcements around helping with staffing amounted to about $16,000 per school. But we know that that's nowhere near enough. But we also know that there's other costs that come along with trying to reduce the class size. So things like finding alternative spaces, hiring more teachers, more cleaners, more custodial staff. Today, I was talking about the concerns around transportation and, cramming dozens and dozens and dozens of kids onto school buses. And what does that do to the safety, not only of the kids, but the safety of the drivers? Apparently lots of confusion exists still 3 weeks before school starts around who's responsible for cleaning the school buses. Drivers are expected to do some of it. Do they get deep cleaned in between pickup and drop off? I mean, there's still a lot of questions that are outstanding.
The cost of going to 15 to 20 students per class must be outrageous. Has anyone costed that out?
Well, I mean, there's a couple of numbers floating around that would be around the $3 billion mark, is my understanding. But again, I mean, I guess it's all relative. I mean, do we want to see COVID-19 spreading through our schools? Do we want kids to bring it home to not only mums and dads, but grandmas and grandpas as well? We don't have, my understanding is anyways, we don't have, a plan to test every child every day before they go home. So there's a real chance of spread here, but we all know that kids need to get back to school and parents need to get back to work. So the other thing is, for those parents that are saying, I don't feel like it's safe, I'm going to keep my child home, where are the resources to support those parents? Where's the extra childcare spaces? Where are extra supports, for folks who are going to lose their opportunity to go back to work, which of course, is going to be mostly women. So there's the whole issue about, there can't be a full recovery without a she-covery. In other words, women have to get back to work as well. So, I mean, there's a lot of pieces, and I think it's really frustrating and troubling to a lot of folks that here we are, so close to school coming back. Toronto's plan just got sent packing by the ministry and the government. people need some certainty as to what's happening, and that window, that window in terms of getting things done in time to start on the regular school return date is closing rapidly. And that's, I think, troubling too for parents.
What about every second day virtual? Does that make any sense?
Well, the virtual piece is something that I think it leaves a lot to be desired, and it still, I think is an experiment. Really, it depends on the child. That we all know that every child learns differently. There are many different types of learning that kids engage in, and that some are good for some kids and not so great for others. So if you're an independent learner, if you're very motivated, really engaged, then that kind of scenario, it works for you. But there's many children. There are many children that aren't in that place, and so it's a lot tougher for them. And then, of course, if parents aren't home, particularly for high school kids, if parents aren't home to provide support, it could be really challenging. I heard that the experiment at the end of the school year in March, April, May, June, didn't go so well. At first, apparently, a lot of engagement, but it fell off very quickly, and there was really not very much engagement by the end of the process.
I've seen this graph. You may have seen it as well, of what happened in Israel with infections once they reopened the schools, and it was a rocket ship of increased infections. Is that possible in Ontario?
I think it certainly is possible, which is why we need to do everything we can to prevent it from happening. And I don't know that that's the case at this point. And again, it really bothers me that the last couple of days I've heard Mr. Ford, talk about it all being about the unions, and yet the school board said that they've been working very closely and collaboratively with the education workers representatives, and the plan that they put forward was one that was one that everybody agreed upon. It wasn't like there was any disagreement, except for the Ford government disagreeing and then pointing to the teachers union. So that doesn't really help. Get off that bandwagon, Mr. Ford. Parents obviously didn't buy it last time around. Nobody's buying it this time around. It's about investing in our kids and investing in our economy, because really, if we can't get people back to work because they don't like the plan and they don't want to put their kids or their families at risk for COVID-19, they're not going to go back to work. And we need those folks back into the workplaces to ensure that our economy is firing on all cylinders as quickly as possible.
We're chatting tonight with Andrea Horvath, leader of the official opposition in Ontario, leader of the New Democratic Party in Ontario. We're going to take a quick break for some messages. Stay right with us, and we'll come right back with Ms. Horvath in just a minute. Well, welcome back to the Brian Crombie Radio Hour. We're chatting with Andrea Horvath, the leader of the New Democratic Party in Ontario. Ms. Horvath, last time we chatted, you had some spaghetti sauce boil over on the oven during the middle of our interview. Have you turned the oven down?
Yeah, no, the oven's, the stove top's off, but the oven's on. I've got some beef braising inside the oven. I try to cook whenever I can, because, in this lifestyle, it's really hard to, to have a nutritious meal. So I try when I can.
What has life been like for a politician during this COVID-19 time period? Have you been isolated at home like the rest of us?
Well, pretty much, especially for the early on months. And then when the legislature began to sit again, I was coming in initially to Toronto from Hamilton a couple of days a week. And then up in July, I guess, we were going in 4 days a week to the legislature. So it's been pretty much bouncing between Hamilton and Toronto. However, the last couple of weeks, I've also started to do some touring. I really thought it was important to get out and actually talk to parents and talk to small businesses, particularly because we're still hearing some horror stories about what's happening in the small business community. And the best way, to get a sense of what people are feeling and what they're thinking is to actually, be on the ground and visiting communities. And so I've been, Brampton, Niagara Horseshoe. I've been to Ottawa, Kingston, Peterborough, Hamilton, my own community, heading to Scarborough, I think tomorrow or the day after tomorrow. So this week. So yeah, I like doing that. I like spending that time, hearing things from the horse's mouth, if you will. Like really finding out where people are at. So.
Well, I congratulate you on that canvassing of what's going on. What is going on? Is there going to be, tons of bankruptcies. I think it's September 2nd when landlords can first kick out tenants for arrears. Are we going to have a flood of expulsions? What do you think is happening in the small business economy?
Well, we're already seeing some of it. We're seeing a number of small business people who are unfortunately in a situation where their landlord didn't take up the federal program. And so the design of that program, of course, is a bit odd in that it's really up to the landlord to determine which businesses live or die, because if they refuse to take up the federal program and their tenants are not able to pay the rent, then it's an eviction. Commercial eviction, and of course we know
Right.
that comes with often a lot of penalties and things like that. So it's really troubling. The restaurant and bar industry obviously is suffering, but we're hearing from a lot of small businesses that they have not been able to bring in any revenue, and they have all kinds of building expenses. So what we've tried to do is get the government of Ontario to do what some of the other provinces have done, which is to provide some extra direct support to small business. We put together, I think I might have talked to you about this when we first put it out. It's called the Save Main Street plan.
Save Main Street.
Yeah, Save Main Street. And it entailed, direct rent subsidies up to $10,000 a month, 75% of your rent, a moratorium on utility payments, a special fund to help with either converting to online or at this point in time, reopening and what you might need to do to invest in changing your physical space, adding PPE, adding barriers, those kinds of things. Unfortunately, the Conservative government hasn't budged in terms of these ideas, but it was endorsed by the Chamber of Commerce. I've visited in my travels not only main streeting with Main Street businesses, but also boards of trade. I've been to the Mississauga Board of Trade, the Brampton Board of Trade. I was just talking to the Kingston Board of Trade last week, and they're all pretty concerned. I mean, they have members in their business districts, in their organizations that are really having a hard time and are not going to be able to make it. So it's they've all endorsed this plan. Well, I shouldn't say they've all formally endorsed this plan, but certainly the Ontario Chamber of Commerce endorsed this plan, as have others. And it's unfortunate because we know that these businesses are also employers, right? And so we're gonna lose a lot of jobs or not have jobs for people to go back to if we lose these employers. And they're all. It's not just restaurants. I mean, I was talking in Kingston to a gentleman who owns a fleet of school buses, and yes, they use some of those buses for regular school back and forth, but it's also sports teams and it's entertainment venues and it's moving people around Eastern Ontario, and the fleet is grounded at this point, has been grounded for months, but there's still expenses on that fleet, and trying to maintain the assets is a big issue. And again, it's it's something that they're staring down a really, really difficult time. The other interesting thing I found out, Brian, which I wasn't aware of because I'm not in private business myself, but I'm hearing a real concern from the boards of trade and some of these chambers of commerce that we really won't get a sense of the economic damage or the volumes of businesses that had to close until the first quarter, till the end of the first quarter next year. That's what folks are saying. And of course, those places that are more reliant on tourism, in terms of their business districts, got hurt even harder. So places like Niagara on the Lake, for example, where I spent some time, places like Kingston, and then those towns that are university towns, again, are going to have another blow because they're not going to have the thousands of students and their parents come to enroll in university or college. And so there's still a lot of
it goes on and on, and
it really does.
Even like you talked about Main Street, but all those chain stores and malls are going to be impacted. The shopping centers, other than the grocery stores that have been able to be open and the Dollaramas that have been able to stay open. I had some people from Destination Toronto on, and they talked about potentially giving people the opportunity to go to Ripley's Aquarium, which is at 1/3 capacity, and other downtown Toronto tourism establishments that people may not have visited more frequently, and really sort of inducing people to travel locally, domestically. But she said their biggest demand is conventioneers, and conventions aren't coming back.
Yeah. Yeah, it's those large venues. I mean, I can remember I was on tour during the Raptors playoff games, and I was in Kingston, and we went to the stadium, the big arena there, and they had people coming in to watch the games on big screens, and the woman who runs that facility was at our meeting, and she said, I don't know what we're going to do. We don't know when venues like ours are going to be able to welcome people back, and it's a real problem.
So let me ask you a question, and this may not be fair, but if you take away as government, I know you're not the government, but if government takes away my land or my business or my house or whatnot because they want to build a road or because they want to build a police station or something like that, they have an obligation to compensate me for the value of that property. If they take away my business for a public health issue, don't they have an obligation to compensate me for that business?
Well, I mean, I certainly think so. I mean, I think this is exactly the role of governments during situations like this. I mean, we asked people to shut the doors. We asked people to stop providing, service. We asked people to literally lock up and go home and send your staff home and send your customers home. The very least we should be doing then. Folks, they did what they were supposed to do. They stepped up to the plate and did what they were supposed to do, helped us flank that curve. The very least we should be doing, I think, is trying to help them survive so that they have a business to go back to. And unfortunately, that's not the way Mr. Ford sees it.
So I've spoken to some money management people that think that we are in a depression and that maybe we've got a little bit of the pent up demand right now and the froth because of in the real estate market, no one being able to buy a house for a while and no one being able to sell a house for a while. But that with all of the layoffs, once the money from the federal government to the provincial government runs out and stops, bankruptcies, furloughs, wage reductions, etc. Once that sort of flushes through, that it's going to be kind of a depression economic situation. If that's true, what does the government need to do to get us out, not of a recession, but a depression?
Well, I mean, what I think they shouldn't do is what they seem to be indicating that they're doing already. I mean, so I don't think the path is one of further restriction. I don't think the path is one of taking a really financially restrained path. I think that we need to shore people up. I think we need to, and that's going to mean deficits. Absolutely. I don't think people should be afraid of that. I think people need to, welcome government assistance at this time of crisis. I mean, that's exactly what what governments are for, as I've said. And what I fear is that the pain is going to be deep and difficult because Mr. Ford is obsessed about the deficit. We've already seen him try to inflate the deficit numbers himself, which obviously it wasn't true. So he's already using the deficit as a boogeyman to not I think fund things like a safe school opening, to not fund things like a Save Main Street plan. And if things get more darker and more dire, we're going to need more supports for people, not fewer. And I really fear that that's not what this government's all about. And it's going to be some pretty hard times for people.
2008, 2009 with the Great Recession, wasn't it the case that the different jurisdictions that tried to stop the programs too early actually suffered, and the countries and the states and the jurisdictions that kept the financial stimulus going for a little bit longer actually did a lot better?
Yeah, I mean, that's exactly what the evidence shows. And in 2008, 2007, 2008, 2009, that's the time when even the most conservative of governments were investing in people, right? They were bringing in stimulus packages to try to keep the economy going. And yes, it was painful, but it was necessary. And exactly as you described, I mean, there has to be some way to fuel the economy, to get people back to work. And if that's not coming from private interests, it's got to come from the government. Otherwise, you continue to spiral downwards, and it takes that much longer to get things back up and running again economically.
Are there other things that you can do other than grants from the government, to money from the government? For an example, a sizable tax cut or something like that.
Well, I mean, again, I don't believe in trickle down economics, frankly. And when you're cutting taxes, you're usually cutting the taxes of profitable corporations. And so, if corporations are profitable, why would you cut their taxes? You need those revenues to help those companies that aren't profitable to try to get up and running. I mean, I think it's a mistake, frankly. But we've seen Mr. Ford already cutting the taxes of the more well off amongst us, and when you're needing those revenues to provide programs and supports and stimulus packages, it doesn't make any sense. But again, you wouldn't be taxing corporations that are not bringing in profits. I mean, you wouldn't be doing that. That's not how it works. I mean, the taxation system.
The counter to that, obviously, is that those companies that are successful, if you give them the inducement, the incentive to expand, to grow, they might do it. And lots of economists will talk about one of the negatives of this kind of situation where you support everyone is you don't force the restructuring as quickly as you otherwise might. That some businesses actually should go under. Some businesses should have to figure out what something new is to make money.
Well, you know what? I mean, I see the argument there in normal times. I see the argument there in normal times. I don't see that argument in these particular times. And I have to say that we've had years and years and years of corporate tax cuts, but we don't see the investment. Like, we haven't seen productivity investments for years in our country. So I don't agree. And economists can theorize this all they like, but we don't see the reinvestment into plant and machinery and operations and technology the way we should have been seeing over these last couple of decades as corporate taxes continue to reduce. And so that might be an economic theory, but it hasn't been the case here in Canada on the ground whatsoever. And so I think we just have to be really careful about some of the assumptions that are being made when it comes to these kinds of economic theories.
We're chatting with Andrea Horvath, the leader of the New Democratic Party and the leader of the official opposition in Ontario, about COVID-19 and the provincial government response. We're going to take a break for some messages and come right back in just a second. Stay with us. Welcome back to the Brian Crombie Radio Hour, Saga 960. I come to you every Monday through Friday at 6 o'clock on 960 AM, or you can stream me online at www.saga960am.ca. And you can get all my podcasts and video casts online at briancrombie.com. I've got, a unique opportunity, frankly, particularly during self-isolation and COVID-19, of reaching out to and chatting with a whole bunch of really interesting people. And Andrea Horvath, the leader of the New Democratic Party, has been kind enough to chat with me. I think this is our third time talking. And she's incredibly generous with her time, with her ideas. And even though my politics are probably a little bit different than hers, she's been wonderful in chatting with me in that regard. Ms. Horvath, maybe I could ask you about the strategy of flattening the curve to start with. So, you've seen these graphs probably of different Scandinavian countries, and Sweden did not really go with a lot of the typical social distancing and self-isolation and other measures, and went for herd mentality, not herd mentality, herd inoculation, infection, and allowed people to stay open because they were trying to get their economy. They were trying to maintain their economy. Scandinavia, Denmark, Norway have had almost exactly the same GDP growth over the course of the last several months. But dramatically, Sweden has had dramatically higher levels of infection and death. And so therefore, arguing for the economy versus public health has been a bad choice. Do you think we made the right choice in Ontario?
I think nationwide we made the right choice. I mean, I think nationwide we took this seriously and took public health advice. The way that provinces kind of I guess approached things or got themselves engaged in all the pieces that needed to be put together were different in different jurisdictions. Some provinces were out front quicker, and this is not about the timing around COVID and when it hit, but rather around how quickly they were able to respond. So we know that here in Ontario, there was a real lack of nimbleness around the response, and that's something that I think will show even more as we get beyond COVID-19 and look back on how our province did. I mean, as you know, at the very beginning of all of this, we worked really hard to try to be productive as an official opposition. But I think it's pretty clear that we can't say that we did a great job here. I don't think anybody would agree that we've done a great job here. Not when you have 1,850 seniors in long-term care lose their lives, and when you look at.
Should we have been tougher?
No, what I'm saying is the government should have been more prepared when it came to long-term care homes. And
okay, so on long-term care, my understanding is that 80% of the mortality in Ontario has been in long-term care. I'm not sure if that statistic is up to date, but that was a statistic a little while ago. It sounds like that is just a complete tragedy and failure of something. What's gone wrong there?
Well, it is definitely a complete tragedy and a complete failure. And so many families were just, they were just heartbroken, and the anguish that people went through, not being able to see their loved ones as they lost their lives, took their last breaths. I mean, it's horrifying. But Brian, this was not a surprise to anybody. Long-term care has been in a crisis for a very long time. And the previous Liberal government refused to do a full public inquiry with the Wettlaufer murders. And now this government is refusing to do a full public inquiry. We need to get to the solutions to ensure that our long-term care system is actually providing, dignified quality of care for people that need it. But we've known for many years shortages of staff that are working in 2 and 3 different facilities just to try to cobble together a living. We've been asking the government since 2006. We were asking the government for a minimum standard of hands-on care for every single resident. In fact, it was so long ago that the minimum standard was 3.5 hours back then, and it's up to 4 hours now because the acuity of patients has become so much worse, or of residents in long-term care has become so much worse. There's a lot of work that needs to happen in long-term care, and I think one of the things that's extremely troubling to me is that apparently twice, the minister responsible for long-term care went to cabinet, asked Mr. Ford and Mr. Bethenflavy and Mr. Phillips for money for long-term care, once right before COVID hit and once shortly after, and they sent her packing both times. That's just frightening that the government refused to acknowledge.
More money for what? For more regulation or for improvements or what?
Well, I mean, I didn't see the ask, but what we saw in the aftermath was that hospitals had to get engaged. The armed forces had to come to help with the staffing of long-term care. I mean, and I have to say kudos to the Canadian Armed Forces. They did an amazing job coming into long-term care, and to all those people who got transferred from their regular work in healthcare into long-term care facilities. We owe them such a debt of gratitude, but it should never have come to that. And of course, the Armed Forces report is something that finally, moved the curtain away from what was happening in long-term care. And we can't pretend that we didn't see it. And we can't pretend that there wasn't a tragedy there. And so we need to fix all of those things: the staffing levels, the pay levels, the preparedness for infection control and pandemic control. I mean, there's just so much work that needs to be done in long-term care, and our loved ones deserve to have that kind of quality of life. So again, I think abject failure when it comes to long-term care in terms of the government response. But you'll also remember we had so many mixed messages. I mean, the Premier was at the very beginning, the Premier was telling people, go off on March break vacation, have fun, don't worry about it. And then literally within a day, he had to retract that advice. Same thing happened with Mother's Day. The same thing happened with his cottage. I mean, Mr. Ford's one of these people that doesn't think before he talks, and then turns around and does the opposite of what he's asking other people to do, and that's really troubling. But now we're here with the school situation, which we talked about off the hop, but it's the same kind of situation. Lack of messages that are concise, lack of direction that's clear, and it's things change every other day, so parents are at their wits' end. But we've seen a lot of pieces that didn't quite make the grade. The testing it took so long for the testing to be up to par. a very, very long time. It took such an effort to try to get PPE where it was needed, when it was needed. We could go on and on with the way that the government handled COVID-19 here in Ontario. And I think the reason why we were able to plank the curve had more to do with Ontarians stepping up to the plate, staying home, closing their businesses, and using the public health guidelines around distancing, around masks, around hand hygiene. I really do respect Ontarians so much, and I just have so much gratitude, and it's an amazing thing that people were able to do. I'm so proud.
I appreciate that, and I agree with you, but let me challenge you just for a second, if I could, on that. So my understanding is that the residents of long-term care represent less than 1% of the Ontario population. And yet that 1% of the Ontario population have created 80% of the mortality. So did we really need to lock down the other 99% of Ontarians? Or did we just need to do a far better job in long-term care and hospitals and the vulnerable?
Well, I think what we did was we prevented the virus from spreading exponentially, which would have overrun the hospitals. So the whole point of everybody, following the distancing rules, etc., wasn't so much about, you're 35 years old and you get the virus, and so you're not going to die from it. You're just going to be sick for a while, so it's no big deal. Wasn't that. It was about how does that virus spread to the more vulnerable folks who are going to end up on ventilators, who then will be overwhelming the hospitals. And so I think, in terms of, the work that we did, I think it was the right thing to do. Had we not done that, the hospitals would have become overwhelmed. And I think the death rate would have increased, amongst people of 50, 60, 70s. And instead, we have the death rate so high with the very most vulnerable of our senior citizens in long-term care, which then, of course, there's the old kind of adage around, you're judged by how you take care of your most vulnerable, and we failed them badly with
I spoke
COVID.
to a union leader for long-term care workers who told me that there was a judicial inquiry after the SARS issue in 2003, and he said we forgot everything that judicial inquiry recommended. He said there's regulations in long-term care about how big a spoon needs to be, but no regulations in regards to how many residents any one personal care worker can cover, and thought that regulation and the dramatic expansion of the for-profit industry was, and I'm not saying he's right, but I'm just saying this is what he said, is that lack of regulation in regards to staffing, and particularly he was concerned about the personal care worker versus patient ratio was the biggest issue, and that he said that the typical personal care ratio in most of the long-term care has to get 6 to 8 people ready for breakfast within 45 minutes, which is absolutely impossible. And then by extrapolation. Anyway, would you be demanding a public inquiry or a judicial inquiry into our treatment of long-term care after COVID-19?
Oh, we've already called for the government to put together a judicial public inquiry. It's what people deserve. It's what all those families deserve. The government's now, Mr. Ford has decided on a kind of a backroom kind of process, a commission where he's now appointed who's going to be the person in charge, and he's appointed the other people on the commission. But the difference between that and a full public inquiry is the commissioners or the commissioner decides who he's going to hear from, decides who's going to be able to be invited to provide evidence, decides if that evidence is going to be public, if there's going to be any media able to watch the proceedings or not. So it's all pretty cloak and dagger. It's all behind closed doors, and a lot of power to put this, hide this stuff under a barrel and not be open and public about it. What we want is a full judicial public inquiry where if somebody believes that what they have to bring as evidence is important, they can proactively ask to be heard and get standing at a hearing, where a judge has no bias, has nothing to do with the government, completely separate, and would be able to give us the answers we need. And I don't disagree with that union leader. I've been touring Ontario on long-term care at least 3 or 4 times in the last number of years. And as I said, I tried very hard to get attention to some of the horrific situations that were happening in long-term care. And that's why I'm so thankful for the Canadian Armed Forces and their report, because I've seen all of those things myself. Maybe not quite to the detail that they're talking about, but I've talked to family members. I've talked to loved ones. People don't have enough attention in long-term care. They go hours and hours and hours in soiled diapers without getting changed. They go for sometimes a whole full 24 hours without actually being moved out of bed. Bed sores that have literally eroded someone's skin to the point of exposing their bones. I mean, this is horrifying, but it happens in long-term care before COVID. So there's just no doubt that the profit motive is one that I think is not appropriate in long-term care, just like it isn't for hospital care, for example. It shouldn't be about cutting the corners to increase the profits or return on investment to shareholders. Absolutely, it shouldn't be about that. But we know that, it's a profit imperative does exactly that. And the biggest expense in any kind of healthcare related scenario is staffing, right? It's the wages.
Can I ask you a question? So my mom is 88 years old, and she was thinking about going into a long-term care facility, and when we didn't put her in, and she didn't want to go, and she stayed in the home that she's been in for 30 years. And it's a challenge because you've got to have people that come and help her and bring her food and all this kind of stuff. My second cousin is a former leader of the Liberal Party, someone that you may have served in the legislature with. He's I think the longest or the second longest serving MPP in the Ontario legislature. And he was in a long-term care facility, and his family took him out and put him back into the family cottage that was on a farm. Bob Nixon is his name. And
I
both
did
of them
never serve with Bob. I never served with Bob, but I knew about him. So sorry.
And both of them are alive today. And frankly, I wonder if either of them were in long-term care, whether they'd be alive. This union leader that I mentioned earlier said that we have got a big mistake in how we treat our elderly. We warehouse them in terrible conditions until they pass away. And COVID-19 and SARS before it proved it. Have we got a real mistake as a society in how we deal with our elderly?
Well, as I've been trying to get my head around this as well, and as I've talked to family members, I mean, it's a matter of privilege to be able to take care of someone's needs and avoid them going into long-term care. So when families have the financial resources to bring in nursing care, to bring in PSW type care to the home or to the farm or whatever, then that's great. But lots and lots of families can't afford that. Lots and lots of seniors are without strong family supports as well. And so there is no doubt that other jurisdictions are doing things differently. And I think that one of the other reasons the public inquiry is important is because it's not just a matter of doing what Mr. Ford's doing right now, which is trying to expedite the building of more long-term care beds. Well, that's great. But if you're putting more long-term care beds into a system that's already broken and failing our seniors, then really what have we achieved? And so I think we really do have to have a fresh look at what kinds of supports can we provide for seniors to help them maintain their quality of life, their dignity, their ability to stay home longer. Our home care system, unfortunately, is not up to snuff, and it hasn't been for a long time. And people are not able to get the home care resources they need. And of course, if you don't have the extra financial capacity to buy more home care services, then you do end up having very few choices. So I do agree with you. We need to rethink how we support seniors, give them choice, give them quality, give them dignity, and an opportunity to age in a place where they're more comfortable, where they have a sense of of a connection to their environment, to their community. Other jurisdictions, as I said, they have much smaller homes. They create kind of village type of atmospheres with resources that come in to support people, and we're looking at all of that. I'm looking at all of that.
It's obvious that they were vulnerable because of compromised or poor immune systems. But my mom and my second cousin had poor immune systems, and they're okay today because they were insulated, because they didn't have the interaction with other people that were infected. We started this conversation talking about education, and undoubtedly you've seen some of the statistics that I've seen about how more and more young people are getting infected, about how, yes, they may not pass away, but there's vascular system impacts. There's long-term cognitive potential impacts where people are complaining about COVID fog months after they're impacted, and potentially cured from COVID, and yet they still have impacts. People are doing studies on the neurological impacts of COVID-19. Are we taking way too much of a risk in sending our kids back to school in 2 weeks?
Unfortunately, parents have an untenable decision to make. And I think that, I don't think we have to be in this situation where there is a lack of sense of confidence, but that's where we are now. And that window to fix it is really rapidly closing. And so, Mr. Ford, I think needs to realize that if we don't provide the PPE, the cleaning, the extra staffing, the extra classrooms, the smaller classrooms, the distancing, all those things that we know work, then we are very much walking into a dangerous fall. And again, it's something that might not necessarily affect the children as much initially, but there are still, as you identified, Brian, lots of questions about the long-term impacts of this disease, which is fairly new amongst us, right?
So over the course of the next 2 weeks, a lot of parents are going to be thinking about stuff. What's your message to them?
Well, my message is that every parent, every family has to decide for themselves what they think is best. I mean, and it's not true that every family has choices. We know that there are lots of single parents out there that have kids that have to get back to work. And they don't have the choice to stay away from work any longer. They need their kids to be in school so they can start, making sure that they are rebuilding their finances and putting food on the table for their kids. I mean, we know that that there are families that can't afford to have a salary missing from the family going forward, and so it's what's troubling to me is that some of those communities that have been identified as at higher risk because they're the essential workers, the racialized communities, those are the lower income families who aren't going to have a choice and are going to have to send their kids back into school. And what does that say about our commitment to making sure that those folks are safe and that their heroics during the pandemic are acknowledged and recognized? And I don't think we're doing that at all.
Andrea Horvath, thank you so much for your time today. Thank you so much for your comments. I think that parents are going to have some difficult choices. I got to tell you, where I come out on this is that we should be going to 50%. If it's good enough for a restaurant to go to 50%, it's good enough for school to go to 50%. So I'm not sure why we're doing it. And if we're forcing that expense on every restaurant and we're telling every store that they got to limit how many people they come into the stores, if it's good enough for the private sector, it's good enough for the public sector. And if that means that Mr. Ford has to incur a bigger deficit this year, then I think he should do it. And frankly, if we only can have the children come 50% of the time and they've got to do half of their time at home, if that's the only solution, frankly, I think that's okay. I think that some of the people have been able to do online learning extremely well. Not all the time, maybe, but some of the time. So if they came for 2.5 days out of 5 days a week, I don't think that'd be terrible. But I do think that if we allow our children to go, maybe not a year, but even 6 months without education, they're going to be impacted negatively for the rest of their lives.
I agree.
They need that interaction, that social interaction, that educational interaction. They need to learn. They're they're going to be impacted negatively, and we need to get them back to school, albeit we've got to figure out a way to do it safely.
Yep, safely. And for those kids that are, as you said, that if you can get them to stay home half of the time, then we have to provide the supports for the parents to be able to make that happen. So whether that's childcare for the younger ones, whether that's some kind of extra supports to help families cope with that, then we need to think about that too.
Andrea Horvath, leader of the New Democratic Party in Ontario, leader of the official opposition. Thank you so much for joining us tonight.
My pleasure, Brian. Thank you.
That's our show for tonight. Thank you so much for joining us. That's the Brian Crombie Radio Hour, as I said, every Monday through Friday at 6 o'clock on 960 AM, or you can get all my podcasts and videocasts after the fact on briancrombie.com. Thanks for joining us. Good night.